All right, let's dive in. If you're an environmental health professional, especially in the UK, I'm sure you know this feeling. You design what you think is the perfect public health message, but it just doesn't land. Well, today we're going to change that. We're going to build a psychological toolkit filled with powerful insights to make your campaigns actually work. Let's start with a problem that's probably all too familiar. You create this brilliant health campaign, you put all the right facts out there, and then crickets. Nothing really changes. This quote, I think, just hits the nail on the head. So why? Why doesn't just telling people what to do actually work? It really is the great health promotion puzzle, isn't it? You've got the facts, you've got the figures, but for some reason the message just isn't cutting through. So we need to figure out why this is happening, and maybe more importantly, what we can do to solve it. Well, the key, it turns out, is a field called health psychology. You can think of it as the place where psychology and health meet. It helps us understand that all-important why behind people's choices. It looks at everything. Biology, social pressures, our own thoughts. Basically, it explains why someone might know, logically, that smoking is terrible for them, but they still light up anyway. So what this really means is that we've got to move beyond just broadcasting information. It's about getting to grips with how our minds shape our health choices. Health psychology literally gives us the blueprint to design campaigns that work with our human nature instead of trying to fight against it. Okay, let's open up this EHB toolkit. Our very first tool is all about the person. We're going to look at how you can start tailoring your message by understanding the different personalities you're trying to reach in your community. Simple models, like this one from Eisenach, are a fantastic starting point. It kind of breaks personality down into 4 big quadrants. And research suggests, for example, that the sanguine type, that's the emotionally stable extrovert, is often the most open to health messages. So think about it. If you're launching a new recycling scheme, these might be your early adopters, the people you target first to get the ball rolling. But if you want to get a bit more sophisticated, a model like Cattell's 16 personality factors gives you a much more powerful, more detailed picture. Instead of 4 broad types, you get 16 different traits to work with, things like reserved versus outgoing, or trusting versus suspicious. And that fine-grained detail, well, that's where you can really start crafting messages that cut through all the noise. So what's the bottom line here? It's all about choosing the right level of detail. Eisenach's model is great for quickly splitting up a big general audience. But if you want to design a super targeted campaign, let's say for smoking cessation in a really specific community, Cattell's level of detail gives you the power to create a message that truly speaks their language. Okay, next up in our toolkit is a real game changer of an idea. Behavior change isn't just a switch you flip, it's a journey. And to be effective, you absolutely have to meet people wherever they happen to be on that path. Now, what's so cool about this slide is how it maps out that journey. This is called the trans-theoretical model, but most people just call it the stages of change. And it shows how people move from pre-contemplation, where they're not even thinking about changing, all the way through to maintenance, where they're actively working to keep up a new healthy habit. And this just lays it out perfectly. Your role as an EHP has to be different at every single stage. For someone in pre-contemplation about, say, food safety, you're not going to hand them a detailed manual on kitchen hygiene, right? You'd start with something simple, maybe a leaflet, just to raise awareness. But for someone in the action stage, they need encouragement, they need practical tips, not another lecture on why it's important. Your message has to match their mindset. All right, so we know how to meet people on their journey. Our final tool helps give them a little push to move forward. We're going to talk about the power of the internal nudge, a subtle way to get people to make healthier choices all by themselves. So this tool has a fancy name, cognitive dissonance, but the idea is actually pretty simple. This image captures it perfectly. A person is holding 2 thoughts that just don't line up. I drink a lot, and drinking a lot is really bad for me. That clash creates this uncomfortable feeling in your head. And here's the really cool part. As humans, we are basically hardwired to want to get rid of that internal conflict. To make that uncomfortable feeling go away, something has to change. They can either try to downplay the risk or, and this is the goal, they change their behavior to line up with what they know is right. And that drive is an incredibly powerful engine for self-motivated change. So this brings up a really practical question for you in your day-to-day work. How can you frame your messages not as orders, but as information that just highlights this internal conflict? How can you gently point out the gap between what people say they value, like their family's health, and what they're currently doing, to create that little internal nudge?
Okay, so we filled our toolkit with three really powerful psychological ideas. Now let's talk about putting it all together to build campaigns that are smarter, more effective, and that, actually work.
You see, the best campaigns don't just pick one tool and run with it. They combine them. Just imagine using those personality insights from Cattell to write a super specific message that creates a bit of cognitive dissonance in a target group that you've already identified as being in that contemplation stage. Now that is a strategic, powerful intervention. But, and this is a really big but, we have to be realistic. These tools are not a magic wand. Someone might genuinely want to eat healthier, but if they live in a so-called food desert or simply can't afford fresh vegetables, psychology alone isn't going to solve that problem. We have to use these tools with a clear-eyed view of the real-world social and economic hurdles that people are up against. So look, the big takeaway here isn't that you suddenly need to become a psychologist. It's about adding these tools to your professional toolkit and just starting to see your work through this new lens. So the next time you're planning a campaign, just ask yourself, am I targeting the right personality? Am I meeting people where they are on their journey? And can I create a gentle internal nudge? So my question for you is this: when you look at your very next campaign, which one of these tools are you going to use first?